Good afternoon, dear patients. Today we will talk about a case, a clinical case of redness of the glands and foreskin. A man came to us who has had redness of the glands, penis and foreskin for quite a long time, for 3 years. It periodically gets worse during sexual intercourse, especially when using a condom, when using various lubricants, and when washing with some kind of, soap. So that's why he often has to wash the glands of the penis without soap. He went to the local dermato-venerologic dispensary where he was prescribed either Clotrimazole or Triderm cream. At first, Clotrimazole may have helped a little, literally for the first 2 or 3 weeks of use out of these 3 years, but then he switched to Triderm. He applies it from time to time, but now the effect is extremely minimal. Naturally, no tests were conducted except for tests for sexually transmitted infections from the urethra. In this case, of course, an examination is necessary. Examination and, what has already been done, of course, we try never to repeat. Naturally, the most important thing needed is a swab from the glands. This includes a culture from the glands, separate cultures specifically for fungi from the glands, and PCR tests, both for fungi and, for example, for Gardnerella. In some cases, for genital herpes, if there are such suspicions, and so on. Naturally, before taking the tests, it is preferable not to wash the glands of the penis, as this increases the amount of discharge collected. You can find more detailed information about tests for various urological problems, including Balanoposthitis, in a separate video on our channel. If the test results are negative, which is exactly what happened with this man, then it is necessary to run tests for blood sugar, for glycated hemoglobin to rule out diabetes, and also to conduct allergy tests. You can also find a detailed explanation of allergy tests in a separate video on our channel. In this case, there was a slight elevation of immunoglobulin E. All other test results were normal. This still points to a toxic-allergic cause. Redness of the glands and foreskin, unfortunately, is not always successfully treated by doctors. Successfully treated, although patients often claim that, before a certain sexual contact, there were no such redness issues. I was absolutely healthy, and then after the contact, this redness started. How could sexual contact provoke an allergy? Indeed, not everything in medicine is clear, and generally, perhaps it's just the particularities of the skin here, or maybe the same Staphylococcus, which in such a patient were slightly above normal, as bacteria also play their role maintaining that very inflammation. Perhaps some bacteria simply triggered that vicious cycle that exists. However, yes, in this patient there was also an allergic component and so on. Accordingly, the patient was given sodium sulfate, calcium gluconate, courses of injections were prescribed, antihistamines were prescribed as well, even though the Staphylococcus was within normal limits, but its count was elevated up to 10 to the 6th power. Antibiotics were prescribed according to sensitivity, cold compresses were recommended, as well as ointments such as Radavit, Videstim, and so on. All this treatment really led to about an 80% improvement from the current condition, which made the patient very happy. However, during further observation of this patient after 3 to 4 months, the situation worsened again. The patient, of course, could not constantly come in and undergo courses of injections. Naturally, he needed to work and so on. Therefore, it was ultimately decided to perform a circumcision on the patient. In some cases, this is unavoidable, despite a completely correct treatment strategy. So, after such an operation, almost all of the patient's inflammatory changes disappeared. You might ask, how does circumcision affect allergies? It doesn't affect them at all. However, the point here is that the amount of flora that normally lives on the glands is significantly reduced. Accordingly, this provoking factor is eliminated, and the glands being constantly exposed becomes less sensitive and less susceptible to various allergies that may minimally exist in the body. This is exactly what affects the fact that if circumcision is performed in the presence of chronic Balanoposthitis and does not completely resolve the condition, which I have seen in my practice, then at the very least it improves the situation by no less than 70 to 80%. But most often it actually completely resolves the condition over time, which is exactly what happened with this patient. So unfortunately, when it comes to redness of the glands and foreskin, things are not as simple as some short-sighted doctors and well-read patients tend to believe. It's not limited to the Candida fungus. In this patient, tests for Candida fungus were negative both in the culture and the scraping, so it had nothing to do with the issue, and the problem is often much deeper and more difficult to resolve.